Proposition 61, Ben Johnson.
Good evening. The intent of Proposition 61 is to reduce prescription drug spending by the state of California. And it does so by setting an upper limit on the prices that state programs may pay for the prescription drugs that they pay for. The largest state program that this measure would apply to is the state's Medi-Cal program, which provides comprehensive health coverage to the state's low-income residents. We estimate that in 2014-15, just for context, the 8 programs that would primarily be covered by this initiative, they spent $3.8 billion on prescription drugs. Now, the upper limit that this measure would set equals the lowest price paid by the United States Department of Veterans Affairs. And the VA's prices were chosen as an upper limit because they are known to pay among the lowest prices for prescription drugs among any public or private payer in the nation. Turning to the likely impact of the measure, we do find that the fiscal impact is highly uncertain, and one reason actually has to do with VA drug pricing. While VA prices are known to be relatively low, many of them are actually not, many of these prices or information on these prices is not actually publicly available. It's our understanding that for many of the VA's lowest priced drugs, that confidentiality clauses that are inserted into the purchase agreements actually bar public disclosure of those prices. So were this measure to be implemented, it's uncertain whether or not the state could obtain this pricing information and how that ultimately would at least potentially reduce the potential savings under the measure. A second uncertainty revolves around how drug manufacturers would respond under the measure in order to essentially protect their profits. The measure does not require drug manufacturers to extend VA pricing to the state of California. What it does is it prohibits state of California programs from paying more for a prescription drug than the lowest price paid by the United States Department of Veterans Affairs. And so one potential response from drug manufacturers would be to no longer sell that drug to the state of California programs. Another potential response is that drug manufacturers could elect to raise the VA's prices and charge California state programs the higher VA prices. And this could ultimately reduce the amount of potential savings for the state.
Thank you. So the endorsements. In support, we have the California Peace and Freedom Party, a number of Democratic clubs and organizations. In opposition, the Republican Party of California, the Libertarian Party of California, and also a number of Democratic clubs and organizations. In support, we have AIDS Healthcare Foundation, AARP, Asian Week Foundation, the Urban League, a whole range of different organizations. In opposition, we have companies with names like Johnson & Johnson, Bristol Myers Squibb, companies that you see in those drug ads because it's the drug companies. We also have business associations, unions, health organizations, and veterans organizations in opposition. And then Bernie Sanders again wants to weigh in on this one in support, and a number of other, Robert Reich as well, the former Secretary of Labor, but he does live in California, and a number of other representatives, and then, but no public officials in opposition, a few newspapers in opposition, and then the spending on this one is mostly against, 86.6 million against, and it's mostly drug companies that are against it. And then in favor, we have the AIDS Healthcare Foundation, Nurses Association, and then some smaller individual donations. Questions? In the middle here.
Is there anything that could prevent the drug companies from raising the price?
There are a number of factors that would at least influence drug manufacturers' ability to raise the price. One would be general market conditions such as competition, and then there are federal price limits on how much drug manufacturers may charge the VA for current drugs that drug manufacturers are selling to them, and so there is that price limit. Currently, we believe that many VA prices are actually below that limit, and so there would be some wiggle room for drug manufacturers to raise prices, at least legally, but eventually, if they want, they could reach those limits.
Another question? Okay, great.